CNA Safety and Emergency Procedures. Welcome to the quiz. Question 1. You are assisting Mrs. Karen Peterson, a 65-year-old female patient, with hydration. You are preparing to fill her water pitcher. You understand the importance of ensuring the patient has adequate access to fluids. Based on appropriate management of patient water pitchers and hydration, what is the appropriate water level in an occupied water pitcher? Option A. The pitcher should be filled completely to the very top at all times. Option B. The pitcher should be filled about 3/4 full and refilled as needed throughout the day to maintain adequate hydration. Option C. The pitcher should contain just enough water to prevent spilling during transport. Option D. The water level depends entirely on the patient's mood. The answer is B. Pitchers should be filled about 3/4 full to allow for handling and to encourage fresh water throughout the day. Option B is correct. Option A may cause spills. Option C may not provide enough hydration. Option D is incorrect. Question 2. You're assisting Mr. Douglas Harris, a 76-year-old male patient who enjoys reading and other leisure activities. He is recovering from surgery and will be spending considerable time in his hospital room. You want to help him with entertainment and activities to pass the time during his recovery. Based on appropriate assistance with patient recreation and entertainment, how should you assist a patient with reading materials or other entertainment? Option A. Only provide medical and health-related reading materials regardless of the patient's interests. Option B. Provide entertainment and reading materials based on the patient's preferences and abilities. Option C. Choose entertainment for the patient based on what you think is best for him. Option D. Reading and entertainment are not part of patient care responsibilities. The answer is B. Recreational activities should be based on patient preference and ability. Option B is correct. Options A and C ignore patient choice. Option D, promoting well-being, includes recreational support. Question 3. You're responsible for making beds for patients on your unit. You understand that clean bedding is an important aspect of patient hygiene and comfort. Based on proper timing and frequency of bed changes, when should a bed be made with clean linens? Option A. Beds should only be changed if they are visibly soiled or stained. Option B. Beds should be changed whenever a patient transfers locations, when they become soiled, and daily at minimum. Option C. Beds should only be changed during the daily scheduled room cleaning. Option D. Beds should be changed only once per week regardless of need. The answer is B. Beds should be changed daily when soiled and upon transfer/discharge. Option B is correct. Options A, C, and D are insufficient. Question 4. You're attending a diversity and inclusion training session for healthcare workers. The instructor is discussing the importance of respecting patients from different cultural backgrounds and with different beliefs and values. Based on understanding of respect for diversity in patient care, which statement best describes respect for patient diversity? Option A. Treat all patients exactly the same regardless of their cultural background, beliefs, or preferences. Option B. Avoid patients with different beliefs or customs because it is difficult to provide care to people who are different. Option C. Recognize and respect differences in culture, religion, values, and preferences, and adapt care to be culturally sensitive. Option D. Impose your own beliefs and values on patients and expect them to adapt to your way of thinking. The answer is C. Cultural competence involves recognizing, respecting, and adapting care to diverse backgrounds. Option C is correct. Options A, B, and D are not respectful. Question 5. You are assisting Mr. Jerome Mitchell, a 72-year-old patient, with understanding his medications. He has several questions about what his medications are for and how they work. He wants more detailed information from you. Based on appropriate scope of practice and delegation of medication education, how should you handle a patient requesting information about their medications? Option A. Provide detailed pharmacological information about each medication and its interactions. Option B, refer the patient to the nurse or pharmacist, as medication education and information is the nurse's or pharmacist's responsibility. Option C, tell the patient that the nurse will explain medications later without providing any information. Option D, assume the patient will ask someone else if they really need to know. The answer is B. Medication education is outside the CNA scope. Refer to nurse or pharmacist. Option B is correct. Option A is outside scope. Options C and D are dismissive. Question 6. You're assisting the nurse with assessing vital signs for Mr. Robert Anderson, a 68-year-old male patient. The nurse is asking you to measure his apical pulse. You understand that the apical pulse is assessed differently than the radial pulse. Based on proper technique for measuring an apical pulse, how should you correctly measure an apical pulse? Option A, count for 15 seconds and multiply by 4 to get the rate per minute. Option B, palpate the wrist and count the pulse for 30 seconds. Option C, use a stethoscope to listen to the heartbeat at the 5th intercostal space and count for a full 60 seconds to get an accurate rate. Option D, use any easily accessible pulse point and count for whatever time period is convenient. The answer is C. Apical pulse is auscultated at the 5th intercostal space, midclavicular line, for 1 full minute. Option C is correct. Options A and B describe radial pulse technique. Option D is incorrect. Great job! Don't forget to subscribe. Bye!